Okay, we're just about to get started.
I'm here.
Thank you, Roy.
Thanks, Charlie.
You know, Judge, you might ask them to turn their volume.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
This is a historic time for many reasons, but this is the first time, first opportunity we've had at doing a virtual court meeting, just to make sure everybody kind of understands where we are. In order to be able to do that, the presiding officer must be in the room where the meeting would occur, and I am here in the Tarrant County Court Chambers. Along with me is Commissioner Devin Allen and Commissioner Gary Fickus. Online we have Commissioner Roy Brooks as well as Commissioner J.D. Johnson. And this is in compliance with state law. We also have a phone that you can call into and ask any questions or indicate that you want to ask a question, and then what we will do is at that particular item on the agenda, we will call you back and ask and give you an opportunity to make comments, and then we will also at the end have a period of time for public comments. The number, somebody help me right now. The number is on the screen. The number, if you wish to call in and indicate, someone will ask you if there is a specific item on this agenda that you would like to make a comment about, or if you would like to simply make a comment about a matter when we get to the area of public comments. The public comments or questions, the telephone number is again on the screen, but it is 817-884-3025. Again, 817-884-3025. And someone will answer again, record what item on the agenda you wish to comment on, or if you simply wish to make a general comment at the end of the meeting. If I explain that right, Chris, DA's office, y'all are okay with the way we've done that?
So, Your Honor, the vote itself of the court is going to be a roll call vote, and it would be a roll call that you will conduct.
Okay. In case you did not hear what Mr. Manius just said and you're on the line, then what we plan to do is every time we take an action, it will be by roll call so that everyone will understand where everyone is on that particular issue. And with that, I'm going to turn it over to Mr. Manius for the agenda item.
Thank you, Your Honor. Members of the Court, we have 5 items that we want to talk to you about today. You know, just listening to your instructions, as we get to each one and before we take a vote, we'll probably need to see if there's anyone who has called in to comment about that so we can capture that information prior to us taking a vote. So with that, if we could move to the administrator section. On the first one, item A1, we're requesting that the Commissioners Court approve an amendment to the Tarrant County Emergency Management Plan describing the penalties for failure to comply with the plan or any rule, order, or ordinance adopted under this plan. What our recommendation is that, and this is a recommendation from the county's Office of Emergency Management, that section G.2.d be added to the emergency plan and to read as follows. Failure to comply with the emergency management plan or with a rule, order, or ordinance adopted under this plan is an offense punishable by a fine of up to $1,000 or confinement in jail for a term up to and including 180 days.
Okay, at this time, I would like to, if anyone on the line or anyone here in the room would like to ask any questions or make any comments with regards to this amendment to our emergency management plan, now would be the time to do that. So, for whoever's looking for the call-in numbers, if we get anything on that, let me know. So again, if you've got a comment, please, or a question, please call 817-884-3025. And I'm going to wait just a couple of minutes and give anybody who might have a question on that a chance to call in. Any questions at this point in time? Anyone in the audience have any questions? So, again, we've waited a couple of minutes. We've gotten no calls on our call-in line, and there are no questions from anyone here in the courtroom. So, with that, I'll ask the court if I have a motion in a second.
So moved.
To approve the amendment to the Tarrant County Emergency Management Plan.
Commissioner Fickus moved the motion. I believe Commissioner Brooks seconded that. So is there any discussion among court members?
I do have a question for clarification. With us putting this in our plan for the cities who participate in our emergency management plan, this gives them an enforcement action as well, right? Enforcement capability.
That is correct. And I'm going to ask just a second. Commissioner Brooks, Commissioner Johnson, did you hear the question that Commissioner Allen posed?
No.
You're going to have to either come over here or you're going to have to speak louder. That's not going to work.
Good evening, colleagues. So the question that I asked was, by us putting this, making this amendment to our own plan, does that give enforcement capabilities to the cities who are part of our emergency management plan?
And the answer was?
And the district attorney's office has indicated that it authorizes those municipalities that are part of the plan the ability to use this as an enforcement
Thank you.
tool.
Okay, this is Commissioner Fickus. I have a question. The $1,000 fine, that is a one-time fine, or it's?
It'll be per offense. Per offense.
Okay.
Per violation.
Okay, is a violation, they're open today, that's one violation, they're open tomorrow, that's another violation?
Yes, that can be.
Should it not say per day?
No, because it's per violation.
Thank you.
Any other questions?
Judge, I could not hear the criminal district attorney's answer.
Just 1 second, Commissioner Brooks. We'll see if this works. Can you tell us?
Okay, so the question was, is it per violation or, so the answer is it is per violation, and it can be a violation on one day and a separate violation on the second day. So that would be 2 violations. It's a $1,000 fine per violation.
Okay, got it.
Any other questions? Okay, then we're going to go to the vote. Commissioner Brooks?
Aye.
Commissioner Allen?
Aye.
Commissioner Fickus,
Yes?
Commissioner Johnson,
Yes.
and I vote yes. So the vote is 5 for, none against. Next item, Mr. Manius.
Okay, now we could go to item A2. We're going to request that the Commissioners Court approve and sign a resolution for an interjurisdictional emergency management program with the City of Forest Hill and Richland Hills for the provision of emergency management and disaster relief planning and coordination. This would allow these two jurisdictions to become part of our plan.
I move approval.
Second.
We have a motion and a second. At this time, I will open it for discussion, conversation. This is simply adding the cities of Forest Hill and Richland Hills to our plan. There's no other discussion, then I will call the roll. Commissioner Brooks,
Yes.
Commissioner Allen,
Yay.
Commissioner Fickus,
Yes?
Commissioner Johnson,
Yes.
and Judge Whitley is also a yes. So that motion passes 5-0. Next item, Mr. Manius.
Members of the court, if we can go to item A3, we're requesting that the Commissioners Court consent to the continuation of the renewal of the second amended declaration of local disaster due to a public health emergency. This was an order that was enacted by the county judge. It was issued on Friday,
On Saturday,
March 21st, and the effective time was 6 o'clock on Saturday, March 21st. The extension of this order would be to the end, or to 11:59 p.m. on Sunday, April 5th. That's our request, Your Honor.
do I,
2 weeks.
yes, do I have a motion?
Yes.
Commissioner Fickus moves.
Second.
Commissioner Allen seconds. Discussion.
Yes, Your Honor. I have been requesting for several days that we consider a shelter-in-place ordinance, a shelter-in-place order. I gather that we're moving closer and closer to that point. I would note that the Dallas County judge just issued one for Dallas County. I hate that we're always following Dallas County, but it's the right thing to do for us in Tarrant County at this time, and I hope we'll get there soon.
Commissioner Brooks, I appreciate your comment. I will say that, again, the order that you just ratified and that we proposed and made effective at 6 yesterday was similar to the one that Judge Jenkins in Dallas County made effective at midnight last night. And then, again, this afternoon at approximately 3 o'clock, he did announce that he was going to take Dallas to shelter in place as of, I think it's midnight tonight, or
It's midnight tomorrow night.
Okay. And this afternoon, I have met with Mayor Price and with Mayor Williams, as well as talking with the hospital execs around Tarrant County. And, you know, their feeling is that we should give what we have just done an opportunity to go into effect and to see what effect it might have. I think that what we're looking for is some time just to see how it works out. And I am going to disagree a little bit. Dallas's notice goes into effect at 11:59 tonight. So it will be in effect beginning tomorrow morning.
I'm not ready to support anything like that at this time.
I hear, again, you heard Commissioner Fickus. Anybody else have any comments?
Well, I'm not sure if we have any comments from the public. Commissioner Johnson and Commissioner Brooks, can you all hear me okay?
Yes.
Okay, great.
Yeah.
I will say that I share the same concerns as Commissioner Brooks. Quite frankly, it doesn't matter to me which county does what first. If we are thinking of the best interest of the residents of our county, and we know how connected we are as a metroplex. Now, with that said, I would hold with my second with this current action, but hope that we very quickly come to a conclusion as to what our next step is. I know that obviously has been a challenge for many of us, as this is such a fluid situation. But we do have to make sure that as much as we can get out in front of this pandemic, to whatever degree that that's possible, that we practice the courage that it takes to do that.
I do have one of our audience participations. He says he does not want to wish to address the court, but he said that his comments were issue a shelter in place. And so I think that discussion is one that we've just had. Again, he did not wish to address the court in public, but chose to simply say that he was supportive of an issue, a shelter in place.
Judge, I think it's the only way that we are going to flatten this curve. These additional features of the order went into place at 6 o'clock yesterday evening. Do you know how many cases we had, how many new cases we've had since 6 o'clock yesterday evening?
The report by Public Health for today was that we've had 5 new cases today. Now, you know, since that's what our Public Health Director told us this morning. So that's a good point. Let me just kind of recap. We started yesterday. We had 42 active cases. Or excuse me, we have had 42 tests. Test positive. We added 5 today for a total of 47. We have had 1 death. We have had 2 recoveries. And so that means that we currently have a total of 44 active cases.
Of that 44, Judge, how many are classified as community spread?
Commissioner, 1 second. I don't know whether or not Vinny is on the line. Let me see. I think he was, but let me just make sure, or let me see if I can get him on the line. Vinny, are you listening to the court session?
Yes, sir, I am.
That's good. Did you hear Commissioner Brooks's question with regards to how many of the current 44 active cases that we have were community spread?
I can look that up, sir. My session's running a second behind, I guess.
I understand, and that's why I'm going to go ahead and just stick the cell phone under the microphone so whatever you say, everybody's hearing.
Yes, sir. So,
Okay, we have a couple of audience participations that do want to speak to the shelter in place. And so at this time, I'm going to call on one of those and ask them to please state your name, your address, and then make whatever comments that you would like to make. Please know that you have a 3-minute time as far as your comments.
Go ahead, Jamie.
Thank you. I wanted to first say thank you all for your service during this time. I appreciate your diligence in trying to make our community safer. In that, though, I had a question. In a comment, I have recently exhibited all signs of COVID along with exposure. And as a healthcare worker myself, I've tried to get tested and was given resources that yielded no results to a test. I understand that there's not much that you can do once you do get tested and you get the positive result. But my concern is, what are we going to do to all of my patients and everybody that I've been exposed to over the last 6 weeks? You know, how do I notify them when I don't even have a positive result myself, when I can't get tested?
Again, thank you for that comment. Any response to what she just said?
Well, I know that, assuming that Dr. Tanage is being pulled in any number of directions, but I really wish that he were here to respond to that question. That sounds...
I'm sorry, I can't hear her.
They can't hear your response.
I just said that I wish that Dr. Tanage were here to respond to that question, because it certainly deserves a response, and perhaps also from a clinical perspective.
I left my number, and I would appreciate, if somebody could look into that and give me a call back. I did follow the resources and the guidelines that you have set forth by going to my community urgent care at the advice of my physician, and was given the checklist and checked off all exposure lists for the test. However, upon leaving that, I was told that I was supposed to call 211. Called 211 and was given a list of clinics to call to ask if they had to test me. Called every single one, and not one did a test.
One of the questions that I would ask you, now I've got Vinny on the line. I don't know, Vinny, if you were able to hear her question, but we will get him. Go ahead.
I was going to say I heard part of the question, and I understand that the testing availability was the main concern, and we all understand and recognize that that's been a challenge for a lot of our community members, and I can assure you that all of us are working on getting that capability available at a widespread level. For now, there has been some confusion on where to go for testing, and what I have been advising folks is that if you're a hospital or a clinician can do it, that's the best place. They don't have to wait for a public health recommendation for that. They can go ahead and order it from a private lab.
And let me add to that and ask this question, and if you said it, I'm sorry that I'm repeating it, but on our website, near the bottom, once you click on the coronavirus red box at the top, there are 2 ways to be screened to be tested where you don't have to go into a doctor. One is an app that has been put together by Baylor, Scott & White, where you ask some screening questions, answer some screening questions, and then that is submitted, and folks review that and then determine whether or not that needs to be sent up to the next level or not. The other is a nurse hotline that is being promoted by Texas Health Resources, and in that particular instance, you call a nurse and you speak with that nurse, and they will ask screening questions, and from there determine whether they feel like you need to move to the next level. I know that one of the biggest frustrations that everyone has had is they want to be tested, and they're frustrated when they can't get to that particular level. But I will tell you, CDC guidelines, the hospital guidelines in this area, even those 2 that are doing that test, they've indicated that that people need to be, if they need to be tested, then they will be tested, but that if they don't meet the symptoms that would generate the need for a test, that by being tested early, you are simply wasting what is a limited number of swabs and reagents to do that test. And
Correct. But when you do hit every, criteria for the testing, that's when the frustration comes in, because you try to get tested and you can't get tested. I've got pneumonia. I've got shortness of breath. I've got a fever. I've been exposed to a known case of COVID-19. I have travel, both domestic and international, and still can't get tested.
Have you actually filled out one of the screenings, or have you actually talked with one of the nurses? Because you said you talked with several physicians' offices, and did you go in or did you call them, or what did you do?
Both.
And after doing that, what was the reason why they gave to you that you didn't need to be tested?
Nobody told me I didn't need to be tested. They told me that they couldn't test me. They didn't have the capability to test me.
Well,
They gave me phone numbers to call, and I can share those with your group. It's a sheet of paper that I was handed at the urgent care and told me to call a certain phone number. Called that. It was like a 6-hour ordeal of calling people to get nowhere.
Okay, I'm going to hang up, or I'm going to ask that we've got your number.
Okay.
I will take the steps to call and see if I can't figure out what your next steps will be, and then we'll get back with you.
I appreciate it.
And I want to apologize, because I know with what you've said that it must be very stressful, and let me see if we can't get someone to call you from either our public health area or from our safety net hospital, JPS, and we'll see what we can do to help you out.
I appreciate it, sir. And I also ask that, you make it a little bit easier for those that out there that don't have the voice to call and talk in, the elderly that don't know how to navigate the internet. Please make it, easier for them to get testing as well.
And that's why we've got also in there that nurse hotline. But I understand and hear what you're saying. I will say that I'll get details of who you called. I don't want to get that out there right now. But what I will say is, if the physician felt like you should have been tested, they should have written an order. It should then have been sent to a private lab that would have then, they should have actually drawn the sample. It should have been sent to a private lab for them to run, and then you should have gotten your results back in whatever length of time that private lab. But I want to call you or get someone to call you right now, or in the next day, early tomorrow, if not tonight,
Okay,
to help you through that process.
I appreciate it. Thank you.
Thank you very much, and I'm sorry you had to go through this.
Thank you so much.
We have two other calls from people who want to do that, and I'm going to try to figure out, Vinny.
So, Your Honor, Dr. Tanasia, we've got him calling in on the same call that the two commissioners are on.
Vinny, are you on the line yet for the conference call?
Yes, sir, I am.
There it is.
Okay, we're going to let you, hopefully this will make it easier for you to hear these questions as they're coming in.
Put you on for your question. Are you ready? Okay, here. Yes. So here we go. Ready? Okay. Okay, go ahead, Kathleen.
Hi, my name is Kathleen Wilhite, and I'm a emergency medicine and critical care pharmacist here at Texas Health Care's Methodist Fort Worth, and I was calling to implore you to please issue a shelter in place for Tarrant County.
Okay, I appreciate your comments, and again, that's what we're at this point in time discussing, and we will we'll make a decision on that momentarily.
Thank you, sir.
Thank you very much.
Have a good day.
Thank you. You too.
Bye.
there another call?
No, sir. I don't have a phone number for this one.
Okay, I've got a couple of questions. Vinny still on the line?
Vinny is on this conference call.
Okay,
Yes, sir, I am.
okay. Vinny, this is Gary. If I recall, last week and the week before, and everything I've been hearing is do not go to the hospital. Go to your doctor. Now, are we saying now to go to the hospital?
Absolutely not.
Okay. Who?
Yes, sir. The plan is still the same, that we would recommend people go to their private physician or in urgent care. But as you heard, a lot of people are finding it hard because these facilities sometimes don't have the swab kits to get the test. And I think that's been a stress point. A lot of our healthcare partners have been sharing that information with us too. It's a nationwide shortage, unfortunately, and that's been stressing our system.
Okay, so is there not some way that Tarrant County Public Health can acquire test kits? I mean, I'm not trying to put you in a box you can't get out of, but somebody's going to have to do some testing. I mean, who did the testing at the Masada Con? Was that you? Your department?
Yes, sir. Yes, sir. Our department did it, but our governor's office had us get some help from a private lab. And we were able to front the swab kits, and then the private lab was able to give us back those swab kits. Those were our partners at the Clinical Pathology Lab, CPL, because we're critically low on those as well, and we needed to have some supply on hand, and they were able to help us out in that pinch.
Are you aware of any physician group, doc in the box, whatever you want to call it, that is testing people?
Yes, sir. So there's a variety of them, and again, I don't know how low their inventories are running, but they are getting some testing done and are able to send those to various laboratories. The lady that just called earlier, she would be, qualified if she had pneumonia and shortness of breath. And if they had the swab kit, they would definitely send it to a lab, including ours, and the criteria she would need to be even tested at our lab.
So Commissioner, let me give you an example. As I've said on our website, we list two hospitals that are actually doing screenings. One is Scott and White, Baylor Scott and White, and theirs is an app that you fill out online. It then goes to a nurse takes that and looks at the answers, and then if it needs to go further than that, they kick it up to a virtual doctor visit, and then if they kick it and they decide that there's going to be a test, then they make an appointment to arrange for them to come in to be swabbed, and then they send that to I think they have their own lab, and they test it. So as of sometime this week, and these days are blending together, they had done over 2,000 tests. Out of those, they had done over 20,000 apps. 20,000 people have sent the in. From that, they had determined that 2,000 people needed to be screened further, and of that, 200 tests were actually done. THR has similar numbers. So you've got, and then there's some physicians that one way or another, they have got the swabs and the reagent necessary to send that to a lab.
And we're putting that information out.
It's on our website.
For Scott and White. And
it's on our website.
THR.
And the numbers. Okay.
And so there are happening now. Again, CDC and the state have been extremely specific about who public health can test. They have got to meet the criteria. They've got to hit. They've got to be those symptoms. They have to be displaying those symptoms. And once they do that, they can do the swab and they can take the test, and they'll get results back very quickly. But we're also doing those tests for 32 other counties, and they're specifically trying to be available for folks public or first responders, and they also, as folks come in DFW, they're also responsible for some of those. So they're conducting tests, but they're more restricted because they must follow CDC requirements. In the other instances, they're following it also. THR and Baylor All Saints, or Baylor Scott and White, but there are doctors' offices, and what has to happen in order for it to go to a private lab, a doctor has to issue an order. So it may be in that last instance that where this lady went, the doctor may have not had any swabs and may not have been able to do that, or may not have been trained in order to do that. But in that situation, if she met all those qualifications, I would have expected at that time that she would have either been sent to one of either Baylor Scott and White or THR's Voice or to Public Health, and she would have at least had an opportunity to call into Public Health. And as Vinny said, given the symptoms that she has indicated that she has, I think more likely than not she would have been tested either through a private lab or something along that line.
So we do have people that are giving tests.
Yes.
Okay. For whatever it's worth, I just got a text that American Airlines is doing testing for first responders in our area.
I had not heard that, but that's...
I'm assuming it's somewhere at their headquarters.
But again, for tests for first responders.
Right.
Most of these, many of y'all have heard about these drive-through or those are set up for first responders.
Yeah.
Now, let me go back before we continue on with the discussion. The first person I said that did not wish to address the court on the issue, but wanted to issue a shelter in place. His name was Stephen Ruiz, and he lived at 978 River Falls in Fort Worth. Other questions with regards to the ratification of the order that I issued at around 2 o'clock yesterday, went into effect at 6 p.m., and we're asking you that y'all ratify that and approve that going for the period that it would end at April the 3rd at 12, April the 5th at 11:59 p.m.
Okay. I gave you a little bit of misinformation.
Did you?
I did.
Heaven forbid.
Heaven forbid. But I'm going to straighten
But American Airlines called you pretty quick, didn't they?
No. I reread it. It's not American Airlines. It's American Airlines Center. Big difference.
That's in Dallas County.
Yes.
And that has been opened, and they said they would take anybody. They didn't have to just be they could be from Tarrant County. They didn't have to just be from Dallas, but it is first responders only.
American Airlines Center.
Okay. Did you fill out a public information form?
I will.
Do.
Necessary.
Yes, it is.
If you're going to speak, come on up here so we catch you.
I'm not sure I heard Commissioner Brooks.
Wait a minute. Get up though.
Who are you?
Tom Wilder, District Clerk. I'm not sure I heard all of what Commissioner Brooks had to say, but I think he was advocating for shelter in place. And I assume that discussion is not going on right now, though. Is that correct?
The motion that is on the floor is to ratify my second amended declaration of emergency.
Okay. Well, I was admonished and encouraged on Friday by senior members of the judiciary as well as the bar to make sure that my front door was open for access to the courts. So I assume any shelter in place would be modified by the memo that Mr. Main has sent out to us
We're not
earlier
even,
today?
yeah, I hear what you're saying, and I understand that, and what we're suggesting at this point, basically recognizes the importance for, government functions to continue. We have been much more restrictive, and you can read the table that we have attached to that, but this in no way, shape, or form would, close down essential, obligations of the county.
We're happy to work on that.
And I will tell you that you know, while we may be discussing and looking at shelter in place, even at that level, we would not be shutting down the functions, the essential functions, either by law or by choice of the things that we felt like were essential within Tarrant County.
Thank you.
And that's part of the point, Your Honor. We would not be shutting down the essential functions of government or the essential functions of the private sector that people depend on to make it from day to day. We would just be asking people to stay the heck at home.
Well, Commissioner, what I would disagree with you on that is the shelter in place greatly restricts what other businesses can continue. Under the order that
It depends on how you write it, Judge.
The order that I wrote yesterday lets businesses that do not have public coming into them to continue as long as they continue to practice social distancing. And my concern has been, you know, a lot of people think I'm crazy for even putting these restrictions on, and I hope they ultimately turn out to be right. But the reason I'm doing this is because if I'm right in doing what I'm doing, we will hopefully save a lot of lives. If I'm wrong, then the lives will still be saved, but businesses may continue from that standpoint. I know it's a balancing act, but it's not one that we didn't make without talking with, again, hospital folks and with the cities within Tarrant County.
You know what?
I'm not saying that you're either right or wrong, Judge. What I'm saying is that you're not going far enough.
I appreciate your opinion.
If you look at the Dallas shelter-in-place ordinance, it allows essential businesses like grocery stores and pharmacies to remain open. It allows people to continue to shop, to take care of their medical needs, to go to their essential jobs. It depends on how you write the thing.
I understand what their shelter implies. I've just, you know, since they issued it this afternoon, I've just barely had any opportunity to read it, but I think it goes too far at this point in time, and so I'll just have to tend to disagree with you.
Judge, maybe another thought on that, instead of saying shelter in place, just maybe a statement to the effect of you're safer at home.
Well, we have encouraged everyone to stay at home that doesn't have a reason for being out, but shelter in place basically says we're closing any business that, regardless of whether the public is coming in or not.
Right.
And I'm just not prepared at this point in time to go that far. We haven't given the one that I issued yesterday, and there's not many businesses that deal with the public that are left at that point in time. Other discussion at this time?
So then, if we look at our next regular called meeting on Tuesday, what aspects of our response will we be addressing at that point? Because it looks like we pretty much moved stuff from Tuesday to today, right?
Yes, ma'am, but these items are still on Tuesday's agenda.
Okay.
And so you can have discussion about those items because we're not removing them from the Tuesday agenda. We're attempting to act on them tonight.
Sure. Okay.
So I would say to that, we will have every opportunity to discuss this again, and look at the other things, look at the thing that Commissioner Brooks is suggesting. We will not be prohibited from going into that, and at that point in time, we may be ready. But what I would say is I just don't feel comfortable doing that at this point in time.
Do we have a motion?
Judge, do we have a motion on this?
We have a motion and a second, but no vote yet on this item.
Okay, so if there's no further discussion, do we have about shelter in place? Okay, then let's get them in here.
We received this.
You might want to read that into the record, Your Honor.
Okay, this is from a Jennifer Strawn White, and it's written, I am writing because I cannot get through. I am a Tarrant County resident and I do not support a shelter-in-place order. There has not been sufficient time for the current restrictions to take place and impact COVID-19 numbers. We are talking about with 44 active cases, that is 0.0002% of the population of Tarrant County. That small amount of population should not impact the entire population as a whole. This is simply unprecedented and a gross overstep of government. Again, Jennifer Strawn White.
Unfortunately, that percentage of the population does affect the overall population. And to think otherwise is to stick your head in the sand.
Commissioner Brooks, thank you for that. I've got another call on the line that I would like to bring on now and give her an opportunity to talk.
Go ahead, Kimberly.
This is, wait a minute, give me the sheet of paper. This is Kimberly White.
Kimberly White.
And would you please give us your address?
12213 Hunters Knoll, Burleson, Texas, but I am in the Tarrant County section of Burleson.
Good for you. All right, Kimberly.
I think that Tarrant County needs to step up and do a strict shelter in place because people are blatantly ignoring all requests to stay home and avoid public activities. There are large groups of people congregating in public parks, going to shopping centers, and going to unnecessary stores. And this is going to spread like wildfire if we do not do something to get people to stay in their homes and actually stop public contact with other people and keep other people safe. Because when you go out, you don't know if you've been exposed or you're a carrier. So when I have to run into you at work or even somewhere that I have to go, like a doctor's office, you're risking me and my family through your activities. And no, I know there's not a lot of cases testing positive yet, and that's what we want to prevent. We want to keep this as very low numbers so we can starve it out, and the only way we can do that is by actually getting people to get off the streets and stay in their homes. Because people, as long as people are not told to, they're like, it's a beautiful day, so I'm going to go take my whole family to the park. We're going to have a giant picnic with, yesterday you saw groups of 50, 60 people hanging out and playing sports in the park with high physical contact. There were lines of people to go into unnecessary stores. such as Michael's or Boot Barn, or I believe there was even people lined up just to go into Sally's Beauty Supply. So people are still just going out like it's a normal thing, and until the government tells them it's a big deal and they need to stay at home, they're not going to.
Kimberly, we did close yesterday. Our order yesterday closed basically your hair salons, nails, all of those personal type of service businesses, as well as Michael's. So that's what we're saying is we did that as of 6 o'clock yesterday evening, and we have not had an opportunity yet to see what the effects of that will be. I would also, I think I've gotten, I thought I had a text. No, I guess I did not. Okay. Do we have anyone else? Thank you, Kimberly. Do we have any? Do we have another? Okay, we've got another one. Let's put them on now. Let me see the deal. Okay, next we're going to hear from Scott Bagg, and it's regarding not only the shelter in place, I believe it's the shelter in place that he wished to speak about. Scott?
Yes.
Go ahead, please.
Hey, Judge Whitley, I just want to thank the court for all the time and effort all you and all the commissioners put in. I think you're doing a fine job, and I appreciate where we're at in this fight. And I think the orders that you put in place are sufficient. And I'd like to see. I think it's great wisdom to utilize, and let's see how it plays out in the next few days and week to continue where we're at without ordering the additional shelter in place. I have driven around. It is somewhat of a ghost town except for the essential places of grocery stores and things of that. But I appreciate where you guys have done and the wisdom that you've utilized for that. And I just want to thank you for that.
Thank you very much. I appreciate you calling, Scott. I also have a email from Lisa Grimaldi, and she is voicing her objection to a shelter-in-place order at this time, and says thank you for your time and consideration. And she's from Precinct 4429. Also, Esteban Blanco, who said that he tried to call in, and he said, I'm trying to call in. He said, Austin and Houston don't have one. They have a lot more cases. And just says, please, do not put an order in place or shelter in place order in effect. Say again? Okay, we've got some read into the record, and one is from Fran Rhodes. Do not issue a shelter-in-place order. One is for Kim Roberts, not in support of shelter-in-place. Amy Stokes, for shelter-in-place. Jennifer White, shelter-in-place, do not support. Teresa Rogers, comments Dallas County, shelter in place, 11:59 p.m. Shelter in place is necessary. Looks like Aaron Brown, live in Dallas, work in Tarrant County, and says that against. So all I can say is that by saying that they're against the shelter in place. Wait a minute, here comes another. Allison, here we go. Sherdalen, 4 shelter in place. That's all we have right now, so with that, I'm going to call the roll unless there's anybody else that we haven't covered.
I would like just some elaboration on how we decided on the April 5th date for the time frame for this current amendment.
I'm sorry, what was the question?
My question is, how did we come to the determination of the April 5th date for the through date for this current order, or the order that we're discussing right now?
The order that the governor had issued was one that ended April 3rd, which was a Friday. And because this order here is fairly restrictive as relates to what you can access and what you can't access, we didn't want to tie it to the April 3rd date. Because that's a Friday, we wanted to let that run through the weekend, and that's why we recommended April 5th.
But again, this will remain on the agenda for discussion and possible action on Tuesday.
That's correct.
And I will just add that the reason I feel like as we do these orders, for the most part, they should end Sunday evening. Because if we're talking about schools in the future, then that says you're going to start back to school on Monday. Also, I know that nobody would do this, but if we ended the orders on Friday, I really don't want people out partying Friday night and Saturday night. And then, Sunday they recover, and then I kind of like to go to Sunday and Sunday night. It'll end Sunday night, and then they'll go to work on Monday, and maybe that'll give us 5 more days. But the 14-day period was also because most of what public health has said is they need people on a 14-day quarantine type thing.
Sure. And I appreciate that. And of course, I know that there's a lot that goes into this, as does the public, but we have many of these conversations that the public doesn't necessarily fully understand what all goes into it, as they shouldn't necessarily. They're experts about taking care of their families, their businesses, serving the community. So it's just helpful that we provide further explanation as to how some of these decisions are made, so that they don't feel as arbitrary as they may seem.
Thank you, Commissioner. I have 2 more calls, and so with that, I'm going to try to call them and get them on the line. The first is Vanessa Pelt. And if you're listening, Vanessa, be ready, it's fixing to ring. And you're going to be talking online. Hello? Is this Vanessa?
Yes, it is.
Okay, this is Tarrant County Judge Glenn Whitley. If you would please state your name and address, and then talk about the shelter in place or the thing that we're talking about right now.
Well, I live in Denton County, but I work in Tarrant County as a teacher, and I know it is all unknown, but honestly, the best thing to do would be put us in a shelter in place. Everybody wants to get out and get back to their lives as normal as possible, and the only way to do that is to make everybody stay home. Some people view this as an extra spring break. You're seeing and this is not a vacation. We all want to get back to our classrooms. I want my kids to get back to their activities. We want to get back to normal life.
Vanessa, I appreciate your comments very much. You're right. We all want to get back to our normal lives, and I appreciate very much your call in. Is there anything else you'd like to say at this time?
No, sir. I appreciate all the hard work that you're putting in for us and whatnot. We just, we want to be able to move on and be better and get, everybody healthy. I mean, I have a son who's asthmatic, so we have been in the house for 2 weeks. It's hard.
I understand. Thank you very much, Vanessa, for calling in.
Thank you.
Okay, the next call will be Jolene Moore. We're placing that call now. Hi, Jolene. This is Tarrant County Judge Glenn Whitley. You've got, would you please repeat your name and your address and then make whatever comments you would like to make?
My name is Joellen Moore, and my address is 405 Summit Ridge, Euless, Texas, 76039. I would like to thank the court for taking the time to listen to my call. I would like to say in regards to shelter in place that I know it would be an extremely difficult situation on multiple levels to make for the court. However, the coronavirus is not your normal virus. And I live in Euless. We already have 2 cases, and we know we're not testing like we should be, and therefore we don't even have a clear picture of how many people are actually infected in our county right now. And I feel like if we followed Dallas County's direction and we did a shelter in place, we could actually flatten the curve. And this isn't about us in the long run. It's about all of our healthcare providers, the hospitals, our first responders. It would help them in the long run.
Thank you very much, Joellen.
Okay, thank you.
You bet. Have a good day. Okay, a couple more calls. I'm fixing to call Sylvia Rodriguez.
Please leave your message for Sylvia Rodriguez.
Okay, Sylvia, I'm going to try you one more time.
Sylvia Rodriguez.
Sylvia? Nope. Okay, well, we may come back to that, but we're going to move on to Terrence Caston. Terrence, this is Tarrant County Judge Glenn Whitley. You had submitted a request to speak, and so your time. Please repeat your name and your address.
My name is Terrence Caston, 6232 Jackstaff Drive, Fort Worth, Texas, 76179.
Okay, thank you, sir. Go ahead.
And I was calling because me and my wife are both educators, and we've been calling. Of course, we know we're crucial. We need to be reached by our different students, but we're having to go into the building with more than 10 people in the building. More people are working more than others. They told us we'll work 1 day a week. Now it went to 3 days a week. Some people are working 1 day a week, some working 4. So we need some consistency.
Okay, you mentioned that you were working for a school district?
Yes.
The school districts, now maybe you're having to work even though the schools are not in place. Is that the case?
Well, we're having to do online work with that's no problem, but we're having to go in now to assist even with lunches. We're having to go in to answer the telephone And I don't think as an educator I should have to do that, or my duties change because of this, because we have administrators to do that.
Well, I really think that that's something that you will have to take up with your school districts. There is nothing that this would not affect that in any way.
Okay.
Thank you, sir. I'm going to try Sylvia Rodriguez one more time. Yes, I was looking for Sylvia Rodriguez. This is Tarrant County Judge Glenn Whitley, and you had submitted a request to speak.
Yes, sir. I am Sylvia Rodriguez. I'm the precinct chair for 4496, and I just wanted to call in against anything doing of the shelter in place. I believe the actions that you've taken the day before yesterday, I've been closely watching you all, and I think as of right now, they're doing well. A lot of the unessential businesses that you closed, I think that did cut down on a lot of high traffic areas, and I believe us doing the shelter in place and being too aggressively with that would help spike some crime in some areas, because people not being able to go to work that need to go to work, and some people wanting to be out. And I think the area, especially my area that I'm over with being the precinct chair, I think there would be some more crime in that area, and that would bring more problems to our elected officials, to our police department, and things of that nature. I think you guys are doing very well, and doing a wait and see. These are guidelines that you put in place, and I think we don't need to jump the gun so quickly as doing the shelter-in-place order as Dallas has. They're different from Fort Worth, and I have forever said we are Fort Worth and we stand alone. So again, Judge, I appreciate what you're doing. I appreciate you taking calls, and furthermore, I have every faith that you all will do the right thing.
Thank you, Sylvia.
All right. Have a good day. Bye-bye.
Goodbye. Next is Jason Aston. Jason, this is Tarrant County Judge Glenn Whitley, and I know that you had put in you had asked to be able to address the court, and so with that, I'm going to turn it over to you and ask you for please state your name and address, and then make your comments.
Yes, sir. My name is Jason Aston. My address is 5724 Wheaton Drive, Fort Worth, Texas 76133. And my comment is that, I know that people are concerned about the potential economic impact of a shelter-in-place order, and we would be foolish to dismiss that concern. However, waiting to see how we do against a disease that we can see has progressed beyond control in so many places is a greater risk, I feel. And if we lose ground to our opportunity now to arrest the advancement of that virus, we're not going to get those days back, and we won't get back those lives lost. And so I would like to support shelter in place for Tarrant County for the time being.
Thank you, sir, for your comment, and we will take that into consideration. Thanks, Jason.
Thank you, sir.
Okay, we've got one more, and then we've got a couple of read into the records, but we've got two more to call, so we'll continue to do this.
This is amazing that we're having this much success with this meeting, doing this way, and having all just amazed.
I think it's working very well.
I really have.
Next, I'm going to be calling Jacob Murray. Jacob, this is Judge Whitley. You had asked to comment about the shelter in place. Please state your name and your address.
My name is Jacob Murray, and I live at 2900 Race Street, Fort Worth, Texas, 76111.
Okay. Go ahead.
So I understand that everybody is concerned about shelter in place, as they should. They're worried about getting enough groceries and things like that. However, to completely dismiss the fact that this virus has an incubation period of 14 days, which means that we could have the entire population of Tarrant County walking down the street and be unaware that they are at risk of catching this virus. And it currently, according to WHO data, it has a doubling rate of 2 days, which means that the number of confirmed cases are increasing every 2 days. We need to do more than just social distancing, because as we've seen on the news, we've got people going out and they're still milling about. They're going to malls, they're going to beaches. We need to have a shelter in place if we're going to have any hope of combating the virus and saving lives and preventing a full-on economic collapse in the wake of this adversary.
Thank you, Jacob. We appreciate your call and your comments.
Thank you.
Next is Rick Stacy. Rick, this is Judge Whitley, and I'm calling in response to your request to talk about the declaration and or shelter in place. So please state your name and give us your address and then make your comments.
Yes, sir. This is Rick Stacy, 1000 West South Lake Boulevard, South Lake, Texas. I just want to say I think you guys are doing a great job. I'm monitoring this on a daily basis. We have to continue to watch these cases as they develop. We know we're scattering all over the world, but I really think you're making the right decision tonight by extending it one more week until April the 5th. And I don't know that it's necessary to have the shelter in place. I think if people would actually read your order, pay attention to it, they would know what to do. They would quit gathering in groups of more than 10. We can whip this thing. The sooner we can whip it, the sooner I can get back in business. I appreciate you very much, Judge.
All right, don't be burning that money, Rick.
Yes, sir.
You're going to need it.
Okay, next is Megan Pelger. And I know I butchered that, Megan, and I apologize.
You've reached Megan Hammond-Pegler. I can't get to my phone right now, so if you'll leave me a short message and your number, I'll make sure to give you a call back.
We'll call her again in just a minute. Boy, I really did mess up her last name. A couple just wanted to record that did not wish. Brenda Patton favors shelter in place. Devin Pipes against shelter in place. You have, okay. Okay, as far as reading in, Sandra Monk favors shelter in place. Clayton Brandt, against shelter in place. Ashley Kissiasard, sorry, Ashley. How are we keeping our children safe? I'm not sure exactly whether to say that's, I'll let everybody be their own interpretation of that. Kenroy Sandel, for shelter in place. Dylan Kandrika, yes, favors shelter in place. Jeff Marcin, I'm glad these people don't work for Tarrant County, because I'd never be able to pronounce their names. Jeff Marcinowski, for shelter in place. I'm fixing to call Doris Salazar. Be prepared.
I have received an email. Jonathan Stickland is against shelter in place.
Okay. Just 1 second.
Judge, while you're dialing, I've got a couple of emails from people saying, what is the email to use to get your comments read?
Hello?
Would you give that information?
Hold on just a second, Doris. Commissioner Brooks, I will do that immediately after this call.
Thank you.
Thank you so much, sir.
Doris, would you please repeat your name and address and then make your comment?
Yes, Your Honor. My name is Doris Salazar. I live at 9801 Drovers View Trail in Fort Worth, Texas, 76131. And my comment basically is, I know we have a lot of callers coming in. I actually was watching this because I utilize global news networks rather than local networks. And I've seen the same repetition over and over again, which is the wait and see. I did read the shelter in place. I've read all your amendments, which is why I need to call in today. And I know that each of you have a lot of responsibility on your hands, right? We have only a few hundred ICU beds. If this turns out to be like many of the examples around the world, like South Korea, Italy, California, New York, and there's too many more million that can't fit in those ICU beds. And I know that one death, an unavoidable death, is one that you don't want in your hands. But unfortunately, I don't think you're going crazy enough. This will go down in infamy, and each one of your names will be remembered, because at the end of the day, it's one thing to say, please stay at home, but we haven't gone far enough like other cities and states. I know everybody's worried about the economy, but believe me, when these people, God forbid, they contract coronavirus and they're on their deathbeds or they feel like they can't take another breath, they will not be thinking about the economy. We will bounce back. We are strong. We are Texans. We've done it before. We will again. So I just really implore everyone to think about what type of fines can we put in place if citizens do not follow your orders. We have restaurants. We have other places that are trying to go to curbside pickup or door deliveries, but people are still touching doors. They're still touching your products, the plastic. We have hundreds of people in grocery stores that even with social distancing, remember, this lives on things for a minimum of 5 days. From the time the manufacturer puts it to a truck that takes it to a grocery store, the person who sucks it, the person who picks it up and puts it on a conveyor belt to be put in a grocery store, that's how we're passing this, let alone the newest research that it sustains in the air for up to 30 minutes. We do not know about coronavirus enough. We've only looked at this for just a short time. It's already mutated twice if you look at the World Health Organization. And that's after when it jumped from animal to human. That is from the CDC. But I don't want to rant or rave, but you cannot take this too seriously. You cannot be crazy enough to protect one life. And that's what I wanted to share today. We'll get through this, but please, I implore all of you, and I ask that you do not dismiss this. I read those shelters in place. I don't think Dallas is going far enough. Please look to New York, look to California, look to Illinois, and I implore you to help Tarrant County. Thank you.
Thank you, Doris. Next is Lauren Stewart. And again, let's give that, I want to give an email address for you to be able to send emails in whether you support or not support shelter in place. That email is MP South. Wait a minute. Here's the email. nmrose@tarrantcounty.com. Okay, I'm going to call a Lauren Stewart. Well, Lauren, this is Judge Whitley at Tarrant County. You asked to make a comment regarding shelter in place. Hello? Hello? Lauren, are you there?
Yeah.
Do you wish to make a comment?
Comment? Who are you looking for? Who?
I'm sorry. This is Tarrant County Judge Glenn Whitley, and you had would you like to make a comment regarding shelter in place?
Who are you?
Tarrant County Judge Glenn Whitley, and you had indicated you wish to make a comment about the shelter in place motion that we're discussing. Yeah, that's what I figured. Okay, Rick Barnes.
Jeez.
This Rick.
Rick, this is Judge Whitley.
Yes, sir.
I think you wanted to make a comment about shelter in place.
Yes, this is Rick Barnes, live at 1508 Dream Dust Court in Keller, Texas. I want to thank all of you for your service. Excuse me. I want to thank all the leaders out there that are in elected roles, because I know this is a difficult time for everybody. I would encourage all of us to remember that in Fort Worth, Texas, and in Tarrant County as a whole, we should never, ever make decisions because Dallas does it. That's not the way we operate over here. If we wanted to do things the way Dallas do them, we should go to Dallas. Tarrant County is a very, very large county, and we've got to remember that when we make decisions like this. These aren't decisions that only affect a small part of the county. We're a large county that represents lots of cities, and so I encourage everybody on the council on the commissioner's court to make decisions with all of that in mind. I also encourage us to remember that we need to pay more attention to the science of a situation like this than to the emotion of a situation like this. We have lots of people on Facebook that are suddenly experts on something called a virus, and those experts usually do not have enough information to be making decisions like these. And so as people are calling in, let's allow our elected leaders to take the time to spend the time with the experts that are in place and to make decisions that are good for the whole. So I want to thank you for your decision, Glenn. I want to thank you for the decisions that you made yesterday, and I want to encourage everybody to give the Commissioner's Court an opportunity to think this through and make decisions that are going to be better for the entire group. So I appreciate everything you guys are doing.
Thank you, Rick. I have a couple of more just record. Beverly Whitt is supportive of shelter in place. Crystal Velasquez is in favor of a shelter in place. I have a comment here regarding self-storage declaration. So I don't think that really pertains to this particular issue. I have a Joe Kimball who is against shelter in place. And then I have this is the last one we have right now, is a Justin Martin. Justin, I believe you called. This is Judge Glenn Whitley. I believe you called.
Yes, hello, Judge. How are you? Thank you for calling me. I just wanted to mention a provision. Santa Clara County went to a shelter-in-place a while ago. This is over in California, but they had a provision in their order that allowed for businesses that needed people there to maintain minimum basic operations. For instance, a lot of people are going to be telecommuting from home, so you would need an IT worker at that facility to make sure the servers were up. Or, for instance, at your zoo, you would need somebody there to feed the animals. So this provision allows for businesses that don't have visiting customers to maintain very minimal staff at a 6-foot distance from each other to maintain products or other vital inventory. So I just wanted to maybe mention that that could be a guide for you to look at to account for the many unique businesses in Tarrant County that need people there to maintain product without endangering other people.
Thank you so much, sir. We appreciate it.
I really do. Thank you. It's really good work that y'all are doing, and y'all have a good evening.
Thank you. Okay, other comments from the court, and then we'll go ahead and take a vote. Okay, roll call vote. Commissioner Brooks. Now, what we're voting on is whether to ratify the order that we put in place, or that I put in place yesterday at 6, and the effective date would be through April the 5th at 11:59. So a yes vote would approve that. A no vote would basically say no to that. Commissioner Brooks.
Yes.
Commissioner Allen.
Yay.
Commissioner Fickus.
Yes.
Commissioner Johnson.
Yes.
And Judge Whitley votes yes. The motion passes 5-0. I know that there may be others. If you would just email in again to nmrose@tarrantcounty.com, then we will place your email into the record. And we've got that on our website now. Mr. Manius, next item.
I lost the report.
Okay, so if we can now go to item number 4. This concerns a approval of leave options related to the COVID-19 pandemic. Let me go ahead and start this discussion because this also is an evolving issue. Today I sent out a memoranda to all department heads and elected officials in an effort to gauge the types of critical services that those departments would have to continue to perform within a certain time period. The reason that we are asking this is we're trying to make a determination to what level of staffing we might have within our departments. A lot of questions came up as related to pay. A lot of questions came up on how do we handle employees that are asked to work from home, don't have the electronics to do that type of activity. A lot of it was where we have people who didn't necessarily had to be in the workplace in order to perform a critical function, but did not have a task to work at home. And then finally, working from home initially was targeted to people who had employees that were exempt, and we have people who are non-exempt. Those are our hourly employees, how we would handle work from home. Last Tuesday, the court gave me the authority to make some deviations from first appearing into the court, and that mainly dealt with non-exempt employees. So the discussion continued, and what the court talked about last Tuesday was to find a way that people who either had small children that they needed to take care of because of the closure of daycare or even school, public school or private school, how they would be compensated if they didn't have any leave balances. We provided a court communication to you that we were anticipating taking up this coming Tuesday. But since this is an item that is very prevalent and on the minds of almost all of our department heads and elected officials. We wanted to lay that out for you today. I'm going to ask Ms. Glenn to come up here and talk a little bit about these recommendations. However, I would like to give you my personal opinion on at least some of those. I believe that whatever we do, that we should not harm our employees financially. So as we begin to craft a policy, we need to ensure that that individuals who may be sent home or can't come to work because of child care or other issues, that the court seriously consider maintaining their salaries so that we do not do any physical harm to our employees. That is my simple comment. That is not a recommendation necessarily from Ms. Glenn, but it's something that I would like to at least put out there for you to consider. Ms. Glenn. You're staying 6 feet away.
I am. Good afternoon.
Afternoon.
Mr. Manies did a really...
We're in the evening now.
Pardon?
I think we're in the evening
I think you may be right. Mr. Manies did a really good job of framing a lot of the discussion that we've had over this past week in particular. I think the federal government was able to help us a little bit in this regard. Earlier this past week, the government, or the president actually, signed into law Families First Coronavirus Act. And so what that act does is a couple of things, and we've tried to sort of summarize that for you on the first page of your communique under background. So what this act does is that it requires paid leave for a period of 2 weeks, and this would be for individuals, employees who are not able to work or telecommute for the following, or not able to telecommute but not able to work for the following reasons. The first is if the employee is subject to a federal, state, or local quarantine or isolation. The second, the employee has been advised by a health care provider to self-quarantine due to COVID-19. The third reason would be if an employee is experiencing symptoms of COVID-19 and seeking medical diagnosis. The next, if an employee is caring for an individual who is subject to an order, as described above. And the next would be if you have an employee who's caring for a child, if the daycare and or school has closed and so care is not available for that child. And finally, if the employee is experiencing other similar conditions as outlined in federal guidelines. So if those conditions exist, this Families First Coronavirus Act requires that we compensate those individuals for 2 weeks. We've been in contact with David from the IT department, and he has, I guess, begun some preliminary work, of course, recognizing that the court hasn't approved anything. Our question to him was, is SAP able to, support, obviously, this kind of leave type? He indicated that it is, and it's something that he can begin working on. Now, this law, it's required that we enact it and implement it on or before April 2nd. So that's the first part of the request for the court. The second part gets a little bit more complicated because the second part would address those situations that are not covered by the Families First Coronavirus Act. So those situations would be individuals who either qualify and they've gone past the 2 weeks, or employees who simply don't qualify. None of those things exist for them. So the question becomes, what do we do about those individuals, and how should their time be recorded? So what we have outlined are some things for the court to consider. Clearly, employees who have sufficient paid leave can certainly use that leave currently, policy says, at their appointing authorities or that individual's designee approval. So that's in place currently. Always the challenge is those individuals who, because perhaps they're a new hire, we have one in my department, she's been with us 3 weeks, and so she's not had an opportunity to accrue time. So we have that category of employee, and then we have employees who may have been here for a significant period of time, but simply don't have any paid leave available to use. So the question becomes, what do we do about those individuals? So what we have outlined in your court communique is something that the courts had asked us to explore, and we have with IT, and that is, I think the question was asked, is it possible for those individuals to be able to, and the way that I'm going to describe it is borrow against their future accruals. So that would leave them in the negative because they don't have the time currently, but as long as they work with Tarrant County, continue to work, they will accrue that time in the future. Again, IT has told us that yes, that is possible. We've been told that that would require about a 10-day work effort to create the pay type that would allow employees to borrow against future accruals. The decision for the court would be, I guess, what schedule the court would like to, and that's not something that has to be decided now, but the court would need to consider how we go about having employees replenish the accounts when we have advanced them time.
So let me be sure I understand one of the first group that we talked about. We are required by federal law to basically give them 2 weeks, and we couldn't implement what you just described as far as a negative comp time for them. We basically have to just give them 2 weeks.
That's correct, and that's clear in the regulations that time is recorded first.
Okay. And so the second group is ones we could decide if we wanted to do the negative or to have to use comp time or some alternative from that.
We don't have comp time. We have not. The county has not.
We don't have negative comp time right now.
We don't have anything called comp time.
Vacation, sick leave, whatever we got.
That's correct.
That people have accumulated.
That's
leave
correct.
Time.
Leave time. So our buckets, Judge, just as a reminder, we have what we call buckets. That's sort of the way we describe and talk about our balances. We have what we call a sick personal bank of time or bucket of time. For every employee, that's 1 day, 8 hours every month. So at the end of a year, that's 12. And then we have a vacation accrual or bucket, and how much you accrue depends upon your years of service with the county. The minimum is 2 weeks. The maximum is 5 weeks per year.
Okay, so, okay, I'm sorry, go forward.
That's okay. That's okay.
Is that pretty much?
Yes, sir. That pretty much sums it up. So, again, I don't know if you all want to take action today or if this is just a discussion item. As Mr. Maney has indicated, we do have this agendized for court approval on Tuesday.
Let me, if you don't mind, let me kind of talk a little bit, because we talked a little bit about this last week, and I would guess since that and since talking with some of the other folks, I would throw out at least a proposal. I think we're going to be at a point where we're going to be closing all but essential services within the county. And given that, what I believe is I don't want to treat one set of employee, different from a standpoint of department to department to department. And so if we're closing things down and or from one group, i.e. the first group to the second group. So what I would like to possibly have y'all consider would be, if we're going to have to give, and I shouldn't say that, if we're giving 14 days to this one group because we're required to by federal law, then I truly believe that we should give the same to the other group that we're not required to do it, but I think we should consider doing that. And that means we would not have to create this pot called negative comp time, and we could go forward with it. The other thing that I think we should say is we should ask there are certain things that we have to maintain to be open in county government. There's some things we believe as a group or as a county that we consider it to be essential, even though the law may not require us to stay open or to continue to be there. But I would propose that we allow, and courts is one of those areas where we're all working. So I guess what I would, the last thing, JD, and then I'll call on you. What I would like to consider is if we have someone that has to be here because it's an essential service or whatever, and we're going to let other people basically be at home and not have to work potentially, then I think those that are at home are going to be paid based upon the federal policy, 14 days, and those that are not required under the federal policy would also be paid for the 14 days. But if you're an essential worker and you have to come in, then I think they should receive a little bit extra, and I would suggest that we pay them time and a half. For the hourly employees, this would apply only to the hourly employees. The exempt employees, we're paying a salary, and therefore, in my opinion, those should not get anything extra, whether they have to be here or not. So I would suggest that maybe we then throw it open and see what the rest of the court would have to say about that.
The April 2nd date, explain that this won't start until then?
Commissioner, as we understand the provisions of the law, we're required, Tarrant County is required to make this time available or to have this time be effective on or before April 2nd.
On or before?
On or before April 2nd.
Okay. Because
we're not recommending that. We're just, what we're trying to do is just follow what the statute says. We would actually, if this is the way we're going to go, we would actually ask that you make it effective beginning today. And then one quick question, is it 14 days or 2 weeks?
It's 2 weeks.
80 hours.
80 hours, okay. So it would be, yeah. Commissioner Johnson, I think I heard you wish to make a comment?
No, sir.
Good. Commissioner
Judge.
Commissioner Brooks wants to make a comment.
Yes, I do. I support your proposal with the caveat that the exempt employees who are at home should be available to do work if necessary. This is not a vacation.
Well, I agree with that, and to the other extent that if we have, there may be opportunities come up that we deem to be essential as far as helping with call-ins or other things, or we certainly ask them to be prepared and volunteer for that. We probably may not be able to force it, but I think that's something we'll explore as we go forward.
Well, we should be able to force them to do the work that needs to be done to carry on the business of our various departments.
Commissioner Brooks, I agree 100%.
I know in our office, we do have work that we can do at home. And I know that some companies are setting up training for employees that are making it available for employees. That might be something we look at. I think there's a lot of different things that we can do with our exempt employees. Because you're right, it's not a vacation.
What's our definition of essential staff or essential workers?
I've got another question, and that relates to our road and bridge operations. What is considered essential as regards our road and bridge operations?
Two great minds think alike. Commissioner Allen had just asked, what do we define as essential employees? So with both of y'all asking the same question, I'll ask Ms. Glenn to address that, and it's going to be interesting.
Well, it will be interesting. You know, I know that some time ago, Mr. Manius is going to have to help me with this because we work hand in hand with his office. But many years ago, the Commissioner's Court identified what we call essential workers here at the county. And so we have a list, I don't have it with me, but we have a list that was created and that we edit as we need to, as people leave county service and then begin county service. And it's countywide. Individuals who have been, who are in positions that have been deemed essential. The last recollection I have of that list being put into effect is when we had the tornado downtown. We could have had something more recently, but I know that because my position on that list was required to report to work. The way that we designate those employees when we process them and issue an identification badge, they actually have a red stripe on them, and so you'll see that I have the red stripe, and so that identifies me as essential staff. Now, again, we have a list of who those individuals are. I would suggest, and we'll see what Mr. Manius thinks about this, of course, we would need to revisit that list and see if we still believe that that's reflective of the individuals that we deem essential.
I do think, I'm sorry, Commissioner.
Go ahead.
I understand the essential employees and the red stripes and all of that. But Mr. Manius's memo that he sent around earlier today said, identify the essential functions, and he went on to say, those that you are legally required to perform. Now, my question is, in regard to our road and bridge operations, what are the functions that we are legally required to perform?
So let me, I'm sorry, Commissioner.
No.
Okay, so a couple of things. First of all, the things that...
Just one second. Gentlemen, can y'all hear GK?
Can you hear me?
No.
Okay, we'll try this again. Hold on.
Okay. It's a very good question, and it's one that is partially defined and one that is not partially defined. So there's really three sources that we're looking at right now. The first one is what Ms. Glenn talked about, the red stripe. Those are people that we feel that are critically important that need to be either on call or down here whenever we do business. The second one, there is a continuity of operation plan that all of our departments have gone through, and as part of that, the departments were requested and required to name those essential employees. So we need to pull that out and look at that also. The third, and it's the one that Commissioner Brooks talked about, and it's the one that Commissioner Fick has talked about, was that the memo that we sent out, we believe that if there is a department that believes there's an essential service, we need them to identify what that service is. If there is a question as far as if they have to legally stay open to perform that service, we ask them to contact the district attorney's office and seek the statutory advice and the legal advice as it relates to that. So what we are doing, we're still capturing some of that. That's why we sent the memo out today. But we're going to look at all three of those sources to determine what a critical function is and who performs that critical function. I would also mention that when we talk about people that are employees that are going to be staying at home, we've already implemented a work from home program. And a good example is we've talked with the auditor today, and she's doing an analysis analysis on her employees that could still provide a work function for the county, but could do that at home. The IT department has a substantial number of employees that can provide services, but they can work remotely from their homes, and they have the equipment to do that. So when it gets to employees that are tasked to work from home, I would recommend that this 80 hours that we're talking about not apply to them, only to those that are sent home with not the charge to work from home. And it has, working from home, you have to create a product that you deliver for the county. It's not just work from home. I know that was a long answer, but...
Yeah, I appreciate it. That answered my question. I want to make sure it answered Commissioner Brooks's also.
You're probably going to have to speak a lot louder.
I feel like I am. So
you're not.
Okay.
No, I was able to hear Commissioner Allen perfectly.
Too bad. Go right ahead, Commissioner.
I was just trying to make sure that Commissioner Brooks had his question answered. So.
Not entirely, but it seems that it's largely up to the department head to determine what is essential and what is not.
I have two. I have two from the same person. Judge Bill Brandt says, while consent among court judges that we should not require our people to take personal time off if we do not have the support equipment for them to work at home. Next is, does the court plan on closing courts? We have 4 essential matters which may arise. Some courts can operate fully from home via existing technology. And I think that except where you're required by law, or you feel like that those services need to be, the ones that are required by law, you cannot close those down. I don't see the DAs shaking their head like I don't know what I'm talking about. As far as the other services, remember that I know the JPs are very active, or they are the ones that hear the evictions. During this time frame, evictions, whether they be from homes, whether they be from apartments, whether they be from long stay hotels, are suspended. You're not able to do those. That's the end of the statement on that. And so not only can they not do evictions, the constables can't do writs of possession.
So when we talk about other elected officials and department heads needing to make this determination as to who's essential and who has the availability of equipment potentially to work from home, where are we on assessing that?
As far as the equipment?
Like IT equipment, for instance.
Okay, so currently we have approximately 80 spare PCs that we're handing out to functions within various departments. For example, public health is going to pick up probably 16 to 20 of those. We've had requests from other county departments for the remainder of those. It's pretty obvious we're not going to have enough equipment like that. We back ordered 150 additional laptops, but we don't have them in yet. And laptops, even when you go to a commercial store to buy a laptop, they're out of stock. Everyone's buying them now. We're exploring another type of avenue of being able to provide equipment to our people that might work from home, and it's something that has been tried in different locations, and it actually works. And when I first heard about it, I had real concerns about it, but it was actually where we send the desktop home with the employee and let them VPN in so that they would have the technical equipment there to work from home. I will tell you, I saw some faces on the court that sounded like, do we really want to do then? We have seen it done before successfully, but we would bring that back to the court for your direction before we do something like that.
Sure. Well, and really, am I asking is just to try to get the fullest understanding, and then also to respond to Judge Brandt's comment about if we are going to require for some people to if we're, hold on, I wrote it down. I probably didn't write it down correctly, but what I understood is that we shouldn't treat employees any differently if they are sent home and unable to work simply because they don't have the equipment to do so.
If it gets to the point that we have to close our front doors of our buildings, and Collin County's already done that, then we need to have a strategy on how we're going to handle our employees and how we're going to pay them. So the memo that you saw today was trying to collect information so we could actually get our arms around, just what the situation would be if, in fact, that occurred.
So I guess, and that's a good point, I think. So what we're saying is, if we get to the point of sending folks home, either because of the first group that we talked about, or if we get to the point to where we're closing doors and as elected officials you feel like, okay, I'm sending these folks home just because out of a sense of safety and as a sense of trying to, that they're not an essential space, and you decide, and they really don't have anything to do because we've closed down the services, then, and that's going to be left up to a great extent, but what we're saying is we're going to pay everybody that's home, that's not working from home, their salary, and we're not taking it out of their, I won't say comp, I'll say
leave pool.
Their buckets, the leave buckets. And then for anybody who is required, essential, and required to work from home, then we're going to pay them time and a half. And if you are an exempt employee, we love you. We love you, but we're not paying you any more money, whether you're here. And you may be working from home, and again, as Commissioner Brooks said, we may, those folks who are at home, but maybe not essential, you still may get a call and be asked about certain questions. There's going to be confusion, and I think we're going to spend some time differentiating between all of the buckets and everything that we're doing, but is everybody pretty clear, at least on the kind of sketchy outline that we put out?
Yes, but it leads me to a question of what about tomorrow? So I'm sure that other officials and or department heads are going to get the question, what do I show up to work tomorrow? So.
Could I address the court?
Only if you come up here and talk. And a lot of that's going to happen, you're right, and the longer the meeting goes on, the later it's going to be before you can call them people.
The only thing I wanted to point out is that in like the auditor's office, because we have such a small space, I technically can't comply with your order if all people come to work. There is no way we can be 6 feet apart, and there's 50 people in a pretty much open area. So I am already working on that, but there will be some other extenuating circumstances such as that where I need to send probably more people home just because I don't have space for them.
I guess what I would say, and we've talked about this a little bit, most of your people, if not all of your people, are at least in a cubicle. Have them sit down, have them sneeze or cough into the wall, and don't stand up and sneeze and cough onto somebody else.
In their arm.
I'm still going to send some of them home in some of the tighter areas
That's
because
fine.
there just isn't room.
That's your choice.
Okay. And then as far as essential functions, I'll share those with GK, but I would offer that if there's anything that my office does that you feel is essential, please let me know. We view payroll, TIF payments, paying vendors, banking as essential because we assume that all those things have to continue, so they're not necessarily provided by law, but they could be. You could say they're provided by law. So
I think we
anyway,
said that it's we're leaving that pretty much up to the department heads and or elected officials and or appointed officials.
Right. And I was simply asking the court for any additional feedback. If there's anything that we do that you're aware of, if you'd share with us.
Sure, and I think, and I hear what you're saying is that we may view something essential, it's essential and we have to do it by law, but then there may be things that are provided by your department that another department is relying upon that is essential that you may not necessarily see it as such.
And I think we're going to have
circumstances.
I think we're going to have to work together because as people are out and as there's vacancies throughout the county, even paying people will be more of a challenge. Making certain that we get the time entered and as these procedures all get in place, because we'll still need to push payroll out.
Yeah.
And I wanted to thank the people that signed up for direct deposit.
Could I ask you a question?
Yes, sir.
From a cash flow standpoint, I'm assuming that this is never good to have this situation, but it's probably better after
It's a much
January
better,
31st than in October.
In October, yes, it is.
Correct?
Yes, very much so. This is a
now,
more plentiful time for resources,
okay.
yes.
And county services that we provide, the vast majority of them are required by law. People have to get their license tags. They have to pay their taxes. So what we're looking at, if we're not in full operation, is the possibility of not, I mean, this is going to cost us money, we know that, but it's more of dollars delayed versus dollars lost. We will get that money.
I would agree with that, assuming that.
No, yeah.
Yes.
I mean, this is
yes.
not.
Yes.
It's going to cost us a lot of money.
Right.
But just some
but
of the other
monies
things.
are all owed.
But
yes, that's your point.
We're going to get
statutorily
our dollars.
Required.
And some of those we may get back because we make the claim that this is a result of COVID-19.
Judge, two things.
Go ahead, Roy.
Number one, I had a communication from one of the justices of the peace this evening, and they apparently had a conference call among themselves earlier today. And there are some cases in each court that are critical and they feel like have to be heard. Their request was that they be allowed to run a skeleton crew of maybe 2 clerks in each court in order to take care of the business of that court. It seems to me that the policy that we're talking about allows that.
I would agree with that.
Okay. The second thing is, are we going to adopt this today? And if so, what is going to be the effective date?
My recommendation would be that we are going to do it today and we are going to make it effective today because that way then we're not sending people home and they not know exactly whether they may have to take bucket time or negative bucket time. They may have to turn it over and pour it out and then wait to pour it back in.
Okay. I've got a couple of road projects that are just in the cleanup stage. I'd like the ability to clean those up tomorrow and get all my equipment moved from those job sites back to the precinct garage and make mine effective for those persons at the garage as of Tuesday morning.
Well, it'll be effective, and you just basically have to say, I mean, it's, again, you can...
That's up to me, right?
That's up to you.
Thank you.
Mary Louise.
So I have a question. So the employees that we say we send home and there is no work we can do because they don't have a laptop, They're in a certain clerk function. The ones we do send home that are clerks that are working from home, they're getting time and a half working from home. The same people that we're having come into the office hourly working. Do you see what I'm saying? If you're coming downtown,
if they're working from home,
okay.
Yes, they would receive time and a half.
If they're hourly.
If they're hourly. And if they're at work?
They're going to get paid time and a half because they're at work.
Okay.
So the statement would be that if they're performing some type of work, if they're performing work for the county, regardless of if they're providing that work or performing that work at the office or working from home, they would be compensated at a rate of time and a half.
And I guess from the court standpoint, the alternative would be to say if you're working at home, then you get regular time just as the ones that are at home. But if you have to walk into a building, it would be time and a half. So that's something that as a court, I think we need to talk about and decide.
And for me, it
I
would just
would be in
equity
favor
issue.
of that last one that you just said.
If they're working at home, they get regular pay. If they're working in the building, they get time and a half.
Correct.
Okay.
My equity issue for that, if you adopt the other way, I will just rotate staff out. Because for an example, an essential function for us would be civil court filings, e-filings. Lawyers all over are constantly bringing that in. If we just shut down, it's just going to thousands and thousands of cases are coming in. So we're going to want clerks, and it's all electronics. We have Tyler on the civil side. We can have clerks coming in and doing that. We feel comfortable with laser focus, taking some of our boxes home, VPN, to the high functioning clerk saying you go home, but it would be equity. You're coming in for 3 days, you work for 3 days. You're coming in for 3 days. If you want to do time and a half at home and at work, that's how I would do it. I would rotate you and you have to come in.
Commissioner Johnson, it sounded like you were wanting to make a statement.
No, I'm just listening to the cluster.
I thank you, sir.
Thank you.
So, and I appreciate your point about equity, Mary Louise. So, what are we adopting today? And I've heard all the conversation and I've made notes, but I want to make sure that I understand exactly what the action that we're supposed to take. We're obviously required to take the action on the federal measure on or before April 2nd. And then what else are we suggesting that we take action on today?
Okay, let me try to encapsulate that, okay?
Okay.
What we're going to ask you to do is to approve the payment of employees that for either working at home or sent home simply because they are not performing a service that is considered an essential service as defined by their department head, or as we looked at in the auditor's office, where that their work environment would violate the 6-foot social distancing. That's one issue.
Okay. Before we move on to the second issue. So with that first issue, then we're saying that our officials and department heads are prepared to, with that determination right now, who's essential? Everyone's already figured that out?
I don't believe that we have.
Okay.
But we have to start somewhere. So
right.
that's what we'll do. That's why we did the memorandum.
Okay.
And hopefully that information will be, we're encouraging the department heads to do that first thing in the morning.
Okay. Well, I mean, and I would hope that as folks saw, obviously, that we're making these iterative changes to all manner of things, that they would be prepared with some type of possible plan. So, okay. Okay, so then the second thing.
Okay. So those employees that simply need to stay at home with the because of the issue of pandemic and actions that have impacted their lives, such as the closure of schools, the closure of daycare centers, that we recognize that leave will be part of the leave that Ms. Glenn talked about with the federal leave of 2 weeks.
So are we, because I heard Leslie specify that it was 80 hours, and we're saying that 80 hours is 2 weeks. I'm just wanting to make it really clear.
Yes.
Okay. Okay.
I think
I would just, the one thing I would add is we've got a number of employees who are, because of health issues, because of a lot of other things, are stressed. And so there's going to be a number of employees who are not essential and who basically want to be home because they feel much safer in their homes.
Right.
And so I think that, you know, we've got great department heads, we've got great elected officials, and this is a point in time when I think we're going to have to give them discretion and just use good judgment. That's all. I mean, we can sit here and what if all night long.
Well, I don't think my question is
No, you're not, but I'm
suggesting
just
what it is.
saying, you know, every elected official is going to have some questions.
Sure.
Every elected official, you know, if you're similar, then hopefully you'll get together as a group and talk about this stuff. We know that over the next couple of weeks, we're going to be sorting this out. So we haven't even thought of probably half the what ifs.
And so Commissioner Allen, the good thing about having court on Tuesday is that hopefully we'll be able to utilize the rest of the evening and tomorrow to see if we need to refine this. I think one of the things that was a real concern to department heads was Tuesday, what if we don't take any action tonight but do it on Tuesday, how are we going to handle Monday?
Right. Which is why I asked, well, what happens on Monday?
Absolutely.
So, okay, when I know that a motion has not been made yet, and I'm fully prepared to make a motion, I just want to make sure that it's a motion that encapsulates everything that we need to make sure that we do right now in advance of Monday morning and in advance of Tuesday's meeting.
And I know that on Tuesday, we're going to have HR, Ms. Glenn, talk to us about how you, and also payroll, on how you record that time. But I'm not going to ask them to comment on that tonight because we need tomorrow to work on that.
Sure. Okay.
Go right ahead.
Well,
Judge.
Yes, sir.
Judge.
Yes, sir.
I think that GK's recap was needlessly complicated. The proposal that you made was a relatively simple one. I would ask that you make that proposal again and take into consideration the things that we have added to it.
Which I understood to be GK's recap that I asked for, Commissioner Brooks. I'm not sure if you heard me, so I'm not trying to be funny.
I agree with Commissioner Allen. No, I
didn't understand what she said.
That's why I agree with her. Okay. And I think I want to go back to what Mr. Mania said in the very beginning. We don't want to do anything to harm our employees.
That's right.
We want to continue to pay those that are home. We want to continue to pay everybody who are in similar, different. If y'all can figure that one out, similar situations. Yeah, you guys, I see you guys back there laughing at me. Are you up for employee recognition anytime soon? It's a good thing. Those folks in essential positions, we're going to look at trying to pay them time and a half. Those that are home, either because of a situation that meets the federal guidelines, they're anxious, or they are working at home, we're going to look at paying them on an hourly. The hourly employees, we're going to look at paying them on their normal rate. those that are essential are in the building, are in their offices in the building. We're going to look at paying them time and a half. And that's the initial thing I would say at this point in time.
So is that a motion?
Yes.
Second.
We have a motion and a second. And again, I'm looking at department heads, I'm looking at elected officials. We're going to go through this, and we are going to find a way to make it work. I got two people that are standing up. And Wilder, you are not demonstrating social distancing, so get further back.
Yeah, I have a question.
That's pretty close.
It ain't 6 feet.
Judge, does what you just described as a motion, does that need to include our court communication on approval of leave options related to the COVID-19 pandemic, these 2 pages of items here?
Yes.
I'm sure that it does.
Well, I would
Unless
think it
does
would.
Yes,
I think we've
okay.
covered all of these. I just want to be sure that that's part of it.
Okay.
That was our intention.
Okay.
Thank you.
Just a second. Wendy, step up here first while the district attorney and her squeaky shoes are around.
Yes, sir. Thank you so much. This is Wendy Burgess for the folks that are on the phone. I'd like for you to consider as moving forward, whether today or on Tuesday, departments that do not have capabilities to work away, such as a department of over 200 individuals that only have 11 laptops in the entire department. We have requested some more as soon as we could have, but as was shared, those laptops are being asked for by everyone, and not everyone can do their work from home. Some work must be done. So I will be determining the essential services for you, and I will have an answer for you tomorrow, but some of that work cannot be done remotely.
Well, if it can't be done remotely, then they won't be working, but they'll still get paid. And if they are in here, and they'll get paid time and a half.
If they're not exempt.
If they're not exempt.
And you'll get your money, one way or the other.
We'll just have folks fighting over who gets paid time and a half and who goes home.
Yes, we will.
Yes, sir.
You're going to make that decision
Yes,
by
sir.
who you say are working and who you say are not.
Yes, sir. I just wanted to point out the fact that in a department of 200 people, 11 laptops available to work from home.
I hear you.
What's the number that you've requested?
I believe we requested an additional 8 for essentials, but as I said, for motor vehicle has been taken care of because of the governor's declaration, so we don't have to worry about that because we have to have a county computer as well as the state computer sitting right beside each other. We've discussed that before. Yes, ma'am.
Okay. Thank
Mr. Wilder.
Thank you, Judge and members of the court. This I don't have to have an answer today, but I hope Ms. Glenn will send us some kind of memo about our many part-time people that we have. Quite a few of them are college students and depend upon this income. I don't know where they would fit in this. I certainly perceived that it was full-time people only, but I need to know something about part-timers.
I would say to you, Mr. Wilder, that no, it is not full-time only. And that if those are not essential, I understand we got people all over this county that are not working right now because we've closed their businesses.
I understand that.
And so I would just have to say, in my opinion, those part-time people, I don't know, we can talk about it as a court, and maybe we pay them for being, whatever hours that they would normally make, but I don't know.
Well, I just need an answer at some point because they'll start asking that tomorrow morning. And,
I think that's a decision you should make.
Say what? Pardon me?
What would you do?
Well, I don't want to lose them because they've become such an essential part of our office. They do a lot of stuff. A lot of this, I cannot make a firm decision today. we need to look at our volume in the courts. That if the volume slows down, then that's going to make a difference on how I want to staff or need to staff. But
and I understand, and for the part-time, we can think more about that. But
That's
again,
all I ask.
your court activity should be slowing down.
It's not, as of the last report, which is now 10 days.
It will.
Well,
10
very
days
well
ago,
might.
we hadn't done any of this, and 10 days ago, we hadn't really closed the courts down. So
I understand.
I hear you. We'll take it into consideration.
Appreciate it. Just if we could also possibly get some kind of memo on the what is decided here today on these personnel matters, so we don't misspeak.
Well, we'll do that in about 2 weeks.
2 weeks. Okay. Whenever we can get one. Thank you.
I think that DA is eagerly awaiting the 6 foot. Okay, go ahead.
So, on the motion, let's start by the simple things. We do not want to necessarily include everything that we had in our court communication until it's reviewed by the district attorney's office so that it conforms with the spirit of your motion.
Great idea.
Okay? And so we're going to take that offline because I think the motion that you made, Judge, is one that the court can act on. That's going to give a lot of relief already just by starting. There's a lot of questions being asked. So this, I think that's good. Second of all, we want to, while we say that employees that work from home are going to get straight pay and employees that are here at the office, and I'm talking about non-exempt, get time and a half, we want to double check that with FLSA to see if we can legally do that before we enter really into some binding order.
Okay.
And like tomorrow's Monday, and we'll be doing that type of research so we can address that.
So it's all subject to us not violating the law.
That's a good start, yes.
So then am I withdrawing my second, or?
No,
Okay.
we're just leaving everything in, and we both understand that we can't violate the law.
You know, actually, I will tell you that the discussion tonight and the action of this motion provides a great amount of clarity and reassurance for our elected officials and department heads on how they're going to conduct business first thing in the morning.
Very good. Okay.
Thank you,
Judge, could I ask that you add to your motion that this is for an initial period of 2 weeks and to be reviewed every 2 weeks?
That's a good idea, and yes.
So that it's not open-ended?
Saying that 2 weeks is sudden.
Yeah, we'll just make it from 2 weeks, and hopefully we'll decide whether or not we need to extend it on a week-by-week basis so that we never don't know what we're going to do after the next week ends.
So I would suggest you extend it through April 7th because our next full court meeting is April 6th.
That'll work through April. Okay, April 7th.
I just didn't want to leave it open-ended.
Good point, Commissioner.
I'm fine with that.
Okay, I'm Sharon Wilson, the district attorney. So I have a staff of 343 employees, about 189 are lawyers, and then the others are hourly employees that are staff and investigators. And I just want to tell you thank you for the relief that you're giving my operation, because those people have been, and that is not a cough, those people have been, you know, hard at work and coming to work and nervous and with families at home, and you've done a great thing. I hope this passes in addressing their very real concerns, and I'm grateful to you for that. Thank you.
Thank you. With that,
ditto.
Thank you, sir. With that, I'm going to take a roll call vote. Commissioner Brooks.
Yes.
Commissioner Allen.
Hey.
Commissioner Fickus.
Yes.
Commissioner Johnson. Commissioner Johnson, star 6.
Yes.
And
Did
Judge
you get
Whitley,
me?
yes, and Judge Whitley votes yes. Motion passes unanimously. The last item is just other discussions related to COVID-19. There being none.
We have this on the agenda for Tuesday.
Yeah, all these items will be on the agenda for Tuesday. I want to end by saying, over this past weekend, there has been a tremendous amount of work being done by a tremendous amount of people. And I want to tell everyone, especially the district attorney and her office, because we've been changing things, writing things. We're writing things for today. We're writing things for next week. We're writing things for a long period of time. There have been a lot of hard work going on, and I want to just tell everybody how much I appreciate it. I also want to tell everybody that I am beginning to see the generosity of the citizens of Tarrant County. And that is to help their neighbors out, to take care of their neighbors, to work with making sure if they have a need that they help them to get that need filled. We're going to make it through this, and I think on the other side we're going to be stronger. But we also need to understand that some of the things we put in place is going to create a great deal of suffering among some individuals, and I think we've got to do everything we can to watch out for them and to help them in any way that we can, and be mindful that whenever we act that it's a ripple in the water and it goes way out. So I appreciate everybody. Mr. Manius, do you have anything in closing?
If you simply, because we do have it on the agenda and advice of counsel, if you just note that that if there's any other public comments, to make them now. If not, well, then we're ready to adjourn.
Are there any other public comments? Hearing none, we're adjourned. That phone didn't ring.